Okay, go ahead.
Okay.
Okay, Renata, it will take some time before we have a video. It says 1 minute left on my computer. Do you want to start?
I think we can start.
Okay, I'll let you know when the video is available.
Okay.
Okay, I think we can start the explanation about your clinic.
Yeah.
Go ahead.
Hi, everyone. We are the Tissue Lab and in Slovakia. We are providing the stem cell treatment from 2015. My colleague Viktor is with us in the Zoom meeting. So if you have any question for us, we will be available to answer you. We are working with autologous and allogenic stem cells. Our tissue bank orthopedic, some diabetes, some autoimmune diseases. We are working with some other countries with the tissue banks. If the people has autologous stem cells, cord blood or tissue, we can ask from another cord blood tissue bank and could do the treatment with autologous stem cells. About our experience and application, what we are doing is that we prepare the stem cell from the cord blood or tissue and isolate the mesenchymal stem cells and preparing for the treatment intravenously, intrathecal, muscular, or a local injection to the joint. So the doctors who is doing these treatments is surgery, orthopedic, traumatology doctors, or for the intrathecal injection, anesthesiologist, pediatric doctor. About our experience with some diseases, a lot of people coming from the Slovakia for the local injection. It's small orthopedic local injection. Our experience is with the diabetic ones. It's for the people who is diabetes 1 gradus or 2 gradus, and it could be local limb injection or intravenously injection. And the big group, what we are doing for the treatment is intrathecal and intravenous for the neurological diseases, autism, stroke, spinal cord injury, some hypoxia, cerebral palsy, or some other diseases. Our patient is not only adult, but the children is too. Children from 1 year old to adult without the age, because our very old patient was a 96 years old woman. So we are not located for the age. It's for the first, so if you have any questions, you can ask.
I'm gonna try to open the video. למישהו שאלה בקהל? If anybody asks in Hebrew, I'll translate. אני אתרגם למי שצריך. Let's see. So Renata, what kind of conditions do you treat in your clinic?
It's from autoimmune, neurological, orthopedic, trauma injury. This is the big group of the patient.
Okay.
Okay, hi, I'm walking out with the baby. I want to ask a little bit about autism, because most of our patients are autistic children. And I wanted to explain for the parents who are listening, what do you need to do where it comes to cord blood? Because a lot of our patients wants to do cord blood transfer. Some of them have their own cord blood. Some of them don't. And I know you use a cord blood bank from Slovakia. And I think it's important for the parents to know. So if you can explain a little about it.
Yes, we can use autologous stem cells from your cord blood. If you have, you can transport to the Slovakia and we inject the own autologous stem cells from your blood, from son or daughter. And if you don't have, we have tissue bank, which is collect the stem cells from the cord blood from Slovakia Maternity Hospital. We have a contract with some hospital, with maternity department, and the mother is donated the stem cell for the another people who don't have. So the agreement about the hospital with maternity department is saying that all donors need to be under the control as a transplant, because we are working under the transplant license for Ministry of Healthcare and National Transplant Organization in Slovakia. So all donors is controlled, and we are as tissue lab controlled by inspection every 2 years. So everyone needs to know that this process is very strictly and need to be under the control, everything. So the donated mother is under the control 9 months after when the baby born, the product is controlled. After 6 months, again, the product is controlled.
Okay, so if, for example, I want to have cord blood from a sibling donation,
yeah.
And if I do tissue classification here in Israel and I send it to you, what level, how many percentage of matching does it have to have? So I can bring, let's say, a sibling donation cord blood, and how many cells are you requiring as a minimum per kilo?
Viktor, could you?
I try to answer. I'm not sure I'm listening. Wait a moment.
I will ask again. Can you hear me now? Because I'm also outside with the baby.
Yeah.
I want to know, when I do sibling donation,
yeah,
okay, I am doing a matching test between the two children.
Yeah.
How many percentage matching does it have to be so I can bring the unit to you?
Yeah.
And how many minimum of cord blood cells is it okay for you to receive a unit? So it's 20 million per kilo, 50 million per kilo. How many do you have to have from cord blood?
Yeah, I understood. Sibling donation is a very specific situation. It's necessary to take the same HLA genetics test, and it's necessary to be compared. And we need 60-65% is minimum for comparing, and it also is necessary to be the same cord blood type. Yeah, you know, the donor and the acceptor is necessary, and some amount of stem cells. It depends. It depends on the decision of the parents. We can use and applicate every amount, every volume of blood, everything. What you have in storage somewhere. But it's a good idea. I started thinking about the applications from 10 millions per kilogram, the stem cells for
so the minimum
donation.
for you is 10 million per kilo? Because in Israel, we do 20 million.
Yeah.
Pittsburgh does 25. And your colleagues in Bratislava are doing 50 million. So can you explain?
Yeah, the 10 millions is absolutely the minimum per kilogram. Okay. When it's the right way to thinking about using the material. So more is always better, of course. Yeah.
Okay, it's good to know. But let's say I have a small unit, but I have a few units. I have my first child, my second child, my third child.
Yeah.
And I want to have all of the units given to the same child because they're all small units. And together it's enough. Is it possible?
When it's possible, according to AGI, typization and genetics and everything, we can put together it. It's
Okay,
not a
so we
problem.
can unite dosages. And in terms of moving the blood from Israel to you, if I use a company like World Courier, no problem.
Yeah,
right?
It is a standard procedure to put together 3, maybe 5 units. Yeah.
Okay, no problem.
Possible.
I have a question from a mom that sent it to me by WhatsApp. She wants you to explain a little bit about CP situation. She has a child with CP, very, very difficult child. She wants to know, how does it work for CP patients? What is the procedure, etc.
Yeah, it's very individual. It's hard to say some strict way how it works. It's really patients by patients, very individual system. The procedure is the same. We use intravenous application, maybe together with intrathecal. It depends on the decision of the parents, and the system is always the same. But the reaction of the body and improving some problems and changes which will take effect and take a part in the future after the applications, it's absolutely, it's nothing 100% we can adjust and everything. So it's very individual. So it's very hard to say what will be work and in which time and what will be improving or something like this.
Have you been treating a lot of CP patients or not so many? What is your experience with them?
It's not so many patients. It's maybe 10, 20 per year. It's not everyday action. So it's most our clients are autism in child field, autism or some injuring or some accident or something like this.
Okay, the parents of the child with CP wants to know if you have any success stories with the CP patients, and if it is possible, if a patient like that calls to ask for any parents who's been treated in your clinic and can speak maybe to the new patient.
It's always the first step, the communication and consultation about the individual problem. So we need some medical reports to see, and then consulting the situation, and then we can decide it's good for you, it's possible, what it's possible to wait after the treatment and everything.
And the connection with the people who is doing this treatment and has experience and improvement, we can connect the parents with parents and asking their success story, how it was, what was the treatment, so they can connect together.
If you'd like, the videos and pictures are ready.
Yeah.
Yes, I think it's good to make a little break to show the video, and then we'll continue.
Okay, what should I start with?
We could do with the CP, and we can send, so no problem to do.
Renata, which pictures or videos do you want me to show first?
You could show the hospital, because the people need to know it's not like only clinic, it's general hospital with 140 beds, with internal emergency and everything. So,
okay, tell me which one to.
It's the lab. Yeah, this is Dr. Hiltz, our medical director.
Okay, this one is the medical director.
Yeah.
Okay.
This is our success story. It's the name John Honzik. He was deep drawing, and after anesthesia resuscitation, and he received 4 times the stem cells. Now he's normally living, could walk, starts the speech, everything. So.
Okay. Is this the video you want?
It's the way on the radiology and on the polyclinics. It's hospital.
This one?
This is the emergency. where it's going if something happens. Yeah.
Okay.
This is the local injection, intrathecally injection in the operating room.
This is how the cells are injected into the spinal fluid.
Yeah.
This is from the lab. It's way to the VIP department where we are doing the treatment, where the people is stay on the day. Yeah. On this department, we have rooms for the patient and the patient with the family staying in this room.
The people that stay in this kind of room are people that do the intrathecal or also the IV.
For the IV application, for the intrathecally injection, we are going to the sterile operating room.
Okay. But people that come from Israel, they're going to stay in these rooms or they're going to be in a hotel and only...
Hotel, we transport from the hotel to the hospital for the intravenous injection and after again transporting for the hotel.
And they need to take care of accommodations on their cells, or this is something that's included in the price, or?
In the price, we including only hospitalization hospital. The people who want to stay in the hotel somewhere, Bratislava, Malacky or Vienna, and we transport him from these cities because some people are coming and stay longer, not only for the application because of way and everything, family vacation, something's completed, everything. So we are doing everything for the patient, but the hotel is accommodation not included in the price because some things want to stay in the hotel, some in the apartments with kitchen and some taking the place with family. So it's different family by family. This is the procedure what we are doing for the autologous stem cells from fat. Dr. Hritz is preparing the patient and made the autologous stem cell fat stromal fraction. And after.
Is this something that we want to watch to play, or is this for next time?
You can share with the
people. I think it's for next time. It's for adults. Today we are discussing mainly children, and we don't do fat stem cells anyway. From with children, it's not for today.
I do have a question. Regarding infants, do you have any experience of treating infants? And if you do, how does it changes the treatment itself? Since, as you explained, for grown-ups, you were doing it using the infusion through the spinal. And what about the infants? Does it changes the way that you are doing the infusion?
For the infants, we are doing the infusion intravenously. If the infants it's under the 1 year, we are not doing intrathecally. It's only intravenous. After 1 year, we have experience. We do intrathecally injection too, because Dr. Dakak, who is doing, it's pediatric anesthesiologist, and he has experience with the very small baby from 1 year old.
And you have some minimum age that you are willing to treat?
Yeah, 1 year.
1 year.
For the intrathecally. For the intravenous, could be the small infant from 6 months.
I have to say here in Israel, we can give IV stem cells from cord blood after delivery. I mean, we know this procedure in Israel. We do it for children who had heart problems and had surgeries. We do it in Sheba Hospital. I'm sorry about the noise. Still walking the baby.
No problem.
So I know that it is possible, and you can definitely treat with cord blood at any age. And I do have some concerns about doing intrathecal with children who have to fly afterwards. I know the ORs and they look okay to me, and I will definitely come and visit you after my son will do his treatment. But I want you to discuss a little bit with the group here about why to choose intrathecal, what can and can't happen, what are the risks with doing intrathecal treatments, because it's a major concern for us. And also if it's a problem and parents are not interested to do intrathecal, if they can only do IV.
Yeah. For the intravenously, if you have the autism children and they not cooperate, the doctor says, could be or not could be the intrathecal, and he is the responsible to say we could do or no without any risk. So sometimes we have the patient, the children who is not cooperate for the blood drawing, and the doctor see it's very hyperactive and don't want to do some risk about the intrathecal injection. So if the parents want, the doctor says no, because the children is very hyperactive, not cooperate, so need to understand the people. We are doing safety treatment, not because the parents want. So this is the first priority for us, safety treatment. For the intrathecal injection is the best because some children don't have any cognitive function, very hyperactive, not speech. So when we inject intrathecally, the stem cells goes to the brain barrier and helps for the children, but needs to be safety. After the intrathecal injection, the children need be in the bed, lying on the back minimum 3-4 hours. So this needs to be too with cooperation with parents, because the children need the parents and the psychological effect and everything. So the treatment need be very, very safety. After
if
this,
the child is not able to lie down in bed for 3 or 4 hours after treatment, he cannot receive intrathecal.
Yeah, yeah.
And
Correct.
if the parents are traveling and they're not interested to do intrathecal, no problem, they can do IV.
Yes.
Can I ask something? If he has to lie down for 3-4 hours, can you just sedate him for this time?
Yes.
Just to stay lying in the bed.
They received when has the injection dormicum or midazolam, like premedication before the operation. So it's 2 or 3 milligrams midazolam or dormicum.
Okay, so he's supposed to lie for this long.
Yeah, they can lie and they are sleepy.
Can you explain the parents a little bit about side effects of lumbar puncture and what do you do to help the children, how you can identify it? Because this child will do this procedure. I have to say, for me as a nurse, it's a major concern to send a child outside of our country to do it. And I think it's important that you will explain all the side effects to the parents.
If we are doing the intrathecal injection, the children stay in the hospital 24 hours. So not only 3-4 hours, but at night to morning with the parents and under the control in the hospital. So this is the best way to using if we are doing the intrathecal injection. If the parents don't want to stay in the hospital, we recommend to stay close to hospital in the hotel or apartments, and we are helping if something happens. The side effects could be headache, little bit fever, or like post-function syndrome, like children feel on how to say, like a cycle or something like this. So we recommend with the paracetamol or brufen for the children and prevent the headache. So this could be.
Can you explain a little more about IV? How many cells are we using IV? Not just for cord blood, because you also do stem cells from placenta and umbilical cord, and we have not discussed it yet at all. And if you can explain a little bit about how many cells you give from stem cells from placenta or umbilical cord, and a little bit about your protocol.
Viktor, could you explain, please?
Yeah, of course. We are using the stem cells in amount between 5 and 10 millions per kilogram of patient weight, and it's very simple way and very simple protocol. The intravenous application, only intravenous application. It's take only around 3 or maybe 4 hours is necessary to stay in hospital for this time. The patients came morning around 9 a.m., 9:30, and we started with some administrative activity with patients, some paper we must to sign and everything, and then we need a blood. So the harvest of the blood of the patients is necessary, and we must put inside the arm or somewhere the cannula. Like a way for intravenous application, and then we need max 40 minutes, maybe 50 minutes for preparing the material in the lab, and then the intravenous application it's take maybe 15, maybe 20 minutes. It's
These are stem cells that are coming from the patient's own blood.
Yeah.
Not placenta and umbilical cord. Patient's own cord blood.
Yeah.
Like PRP.
Yeah.
Do you use stem cells from placenta and umbilical cord?
We are using not from placenta, but from umbilical cord, from the tissue, from the Wortongel isolated. It's the material. In fact, it's the mesenchymal stem cells, mostly clear. When we are using the autologous material, it's a whole cord blood or some fraction of the cord blood, and it's hematopoietic stem cells mostly. And we use whole volume which you bring from your country or from some storage like cord blood bank or somewhere. And this procedure take a little bit more time, maybe 1 hour to prepare everything according to our protocols. So but everything before and after it's the same for the patients.
If I understand correctly, there are 3 options for stem cells in your clinic. Cord blood that you can either bring your own or receive from the local reservoir of cord blood. Option 2 is cord blood, cord tissue mesenchymal cells that you receive from where?
Yeah.
Where do you harvest your cords?
Yeah, it's the same way. It's a donors from Slovakia. After the delivery of the child, we take not only the cord blood, but also the piece of tissue.
The placenta.
Umbilical cord blood. Not the placenta.
But the whole organ. So the placenta with the cord.
Not only the umbilical cord.
Okay.
So only the piece of this tissue.
Option 3 is like PRP. You take cells from the child's own blood.
Yeah, we are using PRP is a platelal rich plasma. It's like a medium for stem cells. It's only.
So you don't give stem cells from child's blood, but you use it as media for the cord blood, for the frozen cells.
We prepare a cocktail with PRP plasma from patients, autologous material, and we put together this material with the donor's stem cells.
Okay,
and,
so I just want to say this in Hebrew so my audience will be very clear with this, because I understand from you that you take child's blood and you use it, inside this blood, you put the material that's being either donated or taken from the same baby at birth. And this is the way you infuse it into the vein. So this would be your liquids, for example. Okay, I will say it in Hebrew now. I think it's important for the people to understand.
So we are not using something synthetic or
okay, so I will just say it in Hebrew because I think this is important for them to understand. כולם פה הבינו מה הם עושים?
אני לא. אני לא הבנתי אם הוא, בכל מקרה כשהוא נותן את ה-IV, משתמש בדם עצמי ומערבב אותו עם הדם של הדונור, או שיש באמת 3 אופציות כמו שאמרת, רק דונור?
לא, אז אני הבנתי, אני אסביר. הסיפור הוא כזה, כדי לתת תאים מוצקים, צריך משהו להעמיס אותם בפנים, צריך שיהיה נוזל, כי זה צריך להיכנס בחזרה לתוך נוזל. הם לוקחים דם מהתינוק, מהילד או מהמבוגר, שמים בתוכו את אותם תאים מוצקים, ובדרך הזאת הם יכולים להעביר את זה, כי אחרת אי אפשר להערות את זה לתוך עירוי, אי אפשר להכניס את זה לתוך עירוי.
אז בכל מקרה של IV הוא ייקח את הדם של הילד?
כן.
זה ממש לא כמו
זה לא אותה שיטה.
לא.
בבלגרד לדוגמה הם ממיסים את זה בתוך נוזל פיזיולוגית, תמיסה פיזיולוגית סינתטית. ופה הם מעדיפים לא להשתמש ברקמה סינתטית, תכף אני אשאל אותו, אלא בדם של הילד. זאת אומרת, הדם של הילד זה החומר שממיסים לתוכו, ממיסים, זה גם לא מילה נכונה, מכניסים לתוכו את אותם תאים, אם זה תאי דם טבורי, אז את הדם הטבורי, אם זה תאים מרקמת חבל טבור, אז זה תאים, אותם תאים בעצם שהם הפיקו במעבדה, במקום בנוזל סינתטי.
אז לי יש 2 שאלות. אחד, זה לא נשמע לי הגיוני שעושים את זה גם עם הדם הטבורי. יכול להיות שהוא
לא,
יתכוון
דם
רק
טבורי
לתאים.
אנחנו מפרידים, מיכל. דם טבורי בעיבוד, אנחנו מפרידים את המוצקים מהנוזלים שלו. מי שלא היה במעבדה קשה לו לדמיין את זה. בדם טבורי יש את הנוזל, את הסרום שאנחנו מקפיאים בנפרד, ואת המוצקים שלו שאנחנו שמים בנפרד. וכשאנחנו רוצים להערות אותם לתוך הווריד, אנחנו או מחברים ביניהם או שמים את זה בתמיסה פיזיולוגית שמתאימה. בשיבה חלק מהזמן מחברים, לא תמיד, תלוי אם יש לי מספיק פלזמה. לפעמים יש בעיה עם הפלזמה, אז אי אפשר לתת אותה. אז זה כן משהו שאת צריכה לדעת. I want to ask...
רגע, אני לא הבנתי, אולי אני פספסתי, הם אמרו מה הכמות של התאים שהם נותנים לקילו?
כן, בין 5 ל10 מיליון תאים, וזה בדיוק מה שהלכתי לשאול עכשיו. אני כבר איתך, אנחנו מכירות מספיק זמן. I want to ask 2 questions before we proceed. One is, why do you use child's own blood in order to put in the stem cells?
Because the plasma, the PRP plasma has some hormones, some factors who is prevent and made prevention for the inflammation. And this is the best way use the own plasma, not some synthetics or some physiological infusion and like this. So this is our best way to use own plasma.
So if I bring you cord blood unit, I bring you the plasma separately and the solids separately, like it's traditional way to freeze it. You use the plasma from the cord blood or child's plasma? Like child.
The patient plasma.
So not what we froze when he was born.
No.
It's just the solid part.
There is a difference between the autologous material and the allogenic. When you have your oven cord blood, we don't need the PRP plasma because in that material we just store it for years maybe. It's inside the plasma. So we only thawing it and cleaning and prepare for application. But when we are using allogenic material from donors, after thawing and during the system and the technology of preparing the material for application, we need to add something with proteins and other things to feed stem cells after thawing. So in this way, it's much better to use your plasma because the material will be injected to your veins after some time, and it's much more better. So when you have autologous material, it's not necessary to use this PRP plasma.
So if I use, let's say, sibling donation, it's the same, like I would use my own cord blood, or you would want to use child's blood to infuse?
In sibling donation, it's the same like autologous material, because it's obtained or it's inside that frozen material. It's also the plasma. Always, it must be.
Okay, so you would unfreeze the plasma I brought with me and use that. And in stem cells from umbilical cord, you use child's blood to infuse.
Yeah.
Okay, so this is clear now.
The child's plasma. We first isolated the plasma from the blood and prepared the PR plasma, and then we use it.
Okay, so I understand now. I want to ask about your dosages for MSC cells, the ones you take from umbilical cord. So you use a particularly high dosage. Like in other clinics, you divide it into a few different injections. And I want to know why you use such high dosage. We heard before about clinics giving 6 million cells a kilo. We heard some clinics divided 3 million and 3 million the following day per kilo. But you use up to 10 million cells a kilo. I want you to explain for children, what does it mean? How do you do it? What kind of protocol it is, so we will understand.
Yeah, it's we are using or applied in practice the very similar protocol like in University of Duke. They have many experience, many years for it, and we try to do the best for our patients. So it's always better to have enough material in your body for regeneration and for every processes. So that's the main reason. And you must know and calculate always with this that mostly it's necessary to come again and again. So it's not only one application, and maybe 3 or 5 is the best way. Some interval between this application, it's 3, maybe 4 months. So maybe 4 applications during the year. It's the best way for the healing processes in our body, and to have or use in practice every possibility of the stem cells. So and the dosage is very individual how to react the body, but it's good to have enough material for everything, and then you can wait the better results. So
let's say I have a very small child. Let's say our average here in Israel, these are children around 3 years old. They don't weigh a lot of kilo. How do I decide to go for cord blood or to go for stem cells like MSC? And if I go for MSC, how many cells are they going to get per kilo? This is a child, maybe 10 or 12 kilo, very small children.
Yeah, it's the first step when you are thinking about the application of stem cells. It's the discussion and consultation with us first. So it depends. What's the medical problem? Which diagnosis is there? What's your weightings from these applications? And many other things. We must read some medical records and everything, and discuss with the parents, and then we try to find a way how to apply it, how many doses in which time, and everything. So the first step is always the consultation and discuss with the parents first.
Okay, but why use cord blood? And why use MSC? Because you do both. Who makes the decision?
Yes, but it's different patient by patient, because you know the autism children could has not only the problem with autism, could have some allergies, some problems with digestive, some motoric skills, and everything. About this we need to know more and more information and some lab tests before the patient is coming. So about this, we are recommend after the hematopoietic or MSC or together both.
So I can come to you and do cord blood and do MSC on the same trip?
Could be, yes.
How does it work for a patient who does both?
It's working normally because by intravenously going under the full body. So
I will, let's say I'm coming on Monday and I do what? What will happen to the patient?
The patient has the intravenous application. Normally we do blood draw, harvesting the blood, preparing and cells too, and intravenously receive the cells in the same day.
But I have cord blood and MSC on the same day?
Could be.
Or you have to separate them? How does it work?
It's intravenously application. So the first could be the cord blood and after the stem cell MSC.
And you have to wait like a few hours or you do it straight away?
You need to continue, stay in the hospital maybe 5 hours.
So you have to stay for a few hours, and then after you stay for a few hours, you would get the second dosage on the same day?
Same day, and after you will be under the monitoring.
Okay, we had a question about your lab. Can you explain a little bit about your lab, where you prepare the cells?
This is normally tissue bank, tissue lab, which is working under the license from Ministry of Healthcare. Every 2 years, we are inspected by the Ministry of Healthcare and National Transplant Organization. In the labs working the manager of quality, manager of labs, some lab technician, and this is under the, in the hospital downstairs. So it's very close to everything. So the labs is downstairs, and our department where we are doing the treatments is the second floor. Operating room is the second floor. So everything is very clear and simplified in the hospital.
It's a standard tissue bank lab. It's a clean space. It's a clean rooms, something like a operating rooms. With the control, the quality of air is controlled, the particles are controlled, everything. We are doing everything with the blood or with the material in the laminar flow blocks and many other things. It's the standard lab. We can prepare maybe some short video or photos from our lab for
yes, I think it will be good. We will upload them to the group. I have a patient's question here. She has a child with autism who weighs 50 kilo, an 8-year-old child. They want to know, other than autism, no other diagnosis. They want to know what would be your recommendation in a case like this? How many cells? Choose cord blood or choose MSC? What do you think?
For the first, we don't know to say because we don't know nothing about the patient. The first step need to be information about the patient. If 50 kilograms and don't have any problems and cooperate, could be the first intravenously with big account because about the weight. So,
but I still don't understand. How do I make the choice? What cases would you say this just cord blood, this just MSC? Can you explain why you would choose one and not the other, or when you choose to combine both?
Yeah, maybe it's a little bit this understanding here, because we are using for intravenous applications, we are using donor's cord blood. So, you know, it's not your cord blood, your autologous, but it's whole package of stem cells isolated from donor's cord blood. So it's a mixture of type of stem cells. There are some part of mesenchymals, there are hematopoietic, so there are everything.
If I come for you and get from you a unit of stem cells. They have cord blood and MSC from umbilical cord in the same unit, in the same medicinal unit.
Mesenchymal stem cells, it's the prior using it's for intrathecal application or for another local application.
Okay. So
for your intravenous
IV,
application, it's
IV
used
just cord blood, IV just cord blood, and intrathecal, it's usually MSC. So
yeah, it's
IV,
strictly only MSC.
it's cord blood.
Yeah, for intravenous application, it's cord blood, donor's cord blood.
Okay, yeah. So if
or your own.
Okay, so now it's more clear. Because until now I thought you do both procedures, but no, if I come for you and I get something in my vein, it will be cord blood.
Yeah, it
will
be donor's cord blood.
Then someone else's.
Yeah, yeah. When you are decided for a combination intravenously and intrathecal application, and if it's not possible to do the intrathecal application because of safety of the patient, we add the mesenchymal stem cells to and mix it with the intravenous stem cells from cord blood.
Can I ask can you recommend to do both, and who can you recommend doing just the IV?
Yeah,
in the terms of autism, let's say you have a kid who is autistic and unhealthy, and then you have a kid who is relatively healthy but severely autistic.
Yeah, the intravenous application is like a base. You know, the first step. It's possible to take a place and for everybody, for every patient with autism. So we recommend it after some discussion for our patients or our future client to first time only for intravenous application. When you have some experience with application of stem cells somewhere in Israel or in Ukraine, Mexico, or somewhere else, you can came and also for first time have a combination. But first time it's good also for your feelings, and you must check everything first time. So it's much better to use only intravenous application first. You will see everything, how it works, you are satisfied or not, do you like it or not, how react your child directly in the hospital, in contact with our personnel. It's possible to control him or manage, and it's cooperation or no cooperation there between the child and the personnel. And then when you decided to come again and again, then we can discuss about intrathecal application. Maybe this is the best way for the patients, for our clients. Somebody came with the decision, I want to intravenous, also intrathecal application. So it's very individual. It's not some strictly steps or strictly procedure how we can do it. It's every ways are good, and every ways are right. So it's not problem to use only intravenous or to combine it.
I have a question here. If you give, they called it mental, but I think what you meant maybe is, אתם התכוונתם, אולי מישהו לא כתב את זה לטשטוש? מי שכתב פה לגבי התרופות? I think they meant what kind of drugs you give for anesthesia. I'm not sure, because they said, they wrote, do you give mental medicine for autistic kids in intrathecal treatment is done. I guess they meant if you do it on a standard anesthesia, and the answer is yeah, obviously yes. You wouldn't do it when the child is awake, right?
For the intrathecal injection, we are not using anesthesia. It's only the premedication, and under the local anesthesia, it means when the doctor is going to the inject to the skin, they use lidocaine or mesocaine. It's only for the to prevent the pain. And if the children is very hyperactive, they use intravenously the midazolam dormicum 2 or 3 milligrams. But this is like normally if you are going to some operating procedure, we are using these two. So it's only premedication, deal with sleepy and little bit light.
If they cooperate and can do it awake, you do it with lidocaine. I'm assuming this will not be for autistic children, but for adults that are coming. And if not, you will lightly sedate them. I will read the question. Whoever is in the crowd can also speak. You don't have to use my services. They wrote, if you use mannitol in your, if you use mannitol in the process of IT.
For some patients, especially for the adult, not for the children, we are using mannitol for the neurological diseases. If they have stroke, spine injury, traumatic brain injury after the accident and things, they use it like before the treatment. So they start with the 50 milliliters intravenously with mannitol and after continue with the stem cells treatment.
So why would you use mannitol?
The body for receiving the stem cells.
I never heard about using mannitol to make the stem cell procedure better. Can you explain?
Yes, it opened the brain and the body for the receiving the stem cells. It's only for the stroke, neurological diseases for the adult people, not for the children.
So you don't need mannitol for children?
No, we are not using mannitol for the children. It's
Why?
only.
Why not for children if it's good for adults?
Because we don't have any experience with this. We never try, so we don't have any clinical trials for the children about this. It's only when we have after accident, brain injury, or some this for the adult.
And maybe for children with CP or brain injury, will you use it then?
No, not for the children.
Thank you. שאלות נוספות, חבר'ה?
Amount of stem cells in IV. How do I choose the amount?
Victor, I think this is for you. Maria wants to know how many cells.
I was not listening exactly. Yeah, how many cells? We have two categories. It depends. It's also the two types of prices then. So the standard, it's between 5 and 10 millions per kilogram, and the biggers, it's more than 10 millions per kilogram. So
you mean by age? The older the child, the bigger the count?
The weight, not the age, right?
Yeah.
Okay, the weight, okay.
So how much weight, where is the line drawn? So like, is it 50 kilo already matches the adult weight, or how does it work?
Yeah, we know, we have some information before the application about the patient. So we have also information about the weight. So we prepare the material. We choose which one will be used for this directly for this client. So it's there are two categories. I said it. So it's a standard way, and it's like boosting or something like this. It's more cells, so the patients can choose. One way is absolutely perfect, and the second way is absolutely perfect. Somebody needs to have or have some informations, or it's not the first time the application, so have some experience, and they need or they want from us the more cells. But the normal amount is between 5 and 10 million stem cells per kilogram of weight.
And we are talking about IV, so cord blood.
IV, yeah.
Cord blood will be between 5 to 10 million cells, or cord blood is minimum 10 million cells a kilo?
Yeah, the 10 millions we was discussing about the sibling application. So there is the 10 millions per kilogram minimum because it's not your own material. So it's a little bit else, and we must try to weigh for this amount. So in fact, we have
I just want to understand because I think it's a little bit difficult for me to understand.
Yeah.
If I do
maybe my English is problem.
No. Maybe. It's always a language problem. So if I use IV, so I'm sending you patients only for IV. The price is for the amount of cells in cord blood, or cord blood is only like minimum amount per kilo. So I know minimum amount will be 10 million cells per kilo. So this child will get at least 10 million cells per kilo, or the price differences is only for the intrathecal.
Yeah, maybe the question about pricing for Renata, this way.
For the intravenous, 10 millions is per kilogram weight. The price is what we send, it's 5,000 euro. If we use intrathecal and intravenous, it's plus, because we need to use another source. So the price will be for the both applications 7,000 to 5,000, because we are doing two procedures.
So if I come for IV, the dosage is from the cord blood, and it's at least 10 million cells a kilo, 5,000 euro, right? Yeah. And if I come for IV cord blood plus intrathecal MSC, the price is how much?
75,000.
75,000, 7,500 euro. And I can choose the dosage only in the intrathecal, not in the IV cord blood.
No.
Again, I will make it more simple. Yeah. When I buy from you a unit of cord blood to give to my child, I cannot choose the dosage. The dosage is being calculated at least 10 million cells a kilo. Am I right saying this?
Yes. We are not doing only intrathecal injection because it's very small volume. It's not help. The children don't have any improvement. So never do all intrathecal injection.
So when I come, I will ask it again. When I come, because you have two prices on your website, you have price for 5 to 10 million cells a kilo and 10 million cells and above. But this is not for cord blood. This is for MSC cells. For cord blood, it's a fix. It's one fix. It's 5,000 euro a kilo. Sorry, 5,000 euro per session, and it's at least 10 million cells a kilo.
Yeah.
Okay, Evantem?
I think no, because the 5,000 euro is price for autologous material, for intravenous application from autologous material. And then for the allogenic material from donors, there are two categories, and there are two categories of prices. The standard amount, it's between the 5 and 10 millions per kilogram. Its price also 5,000 euro. And the higher amount, more than 10 million stem cells per kilogram, it's the price 7,500.
And this is for cord blood material.
Cord blood, yeah.
Okay, now I understand. Okay,
yeah.
because I don't see a point giving 5 to 10 million cells a kilo from cord blood. We see that everywhere in the world they give at least 10 million to 50 million.
20 million minimum.
No, some places still give 10.
Okay.
Because here in Israel, we have these two
possibilities.
It also depends on what you calculate as cord blood. Because here in Israel, like in America, you calculate granulated cells. So granulated cells, it's considered a part.
Everything, yeah.
Okay, but if you calculate it differently, then you need to explain, because when we do the research here in Israel, we use 20 million cells per kilo, no matter how much the child weighs. If he weighs 50 kilo, 50 kilo times 20 million cells a kilo, granulated cells. How do you calculate your cells? What is the calculation you make? For what kind of cells?
Yeah, this is the same. This is the same, the whole group of cells in the cord blood. So it's not isolated according to CD positivity or something. It's a whole material, it's processing, and every these granulate cells, the mononuclear cells are isolated, and this is the number of the cells.
And you see results with children
Yeah,
who
of
are
course,
getting this little amount of cells, so 10 million cells a kilo, you see good results, because it's news to me. Kurtzberg, a very long time ago, said she started with 10 million. Kurtzberg started with 10 million, and very soon after, she said that you need to have a lot more. Now, I remember with my son, we gave him MSC cells in Moskva. Gave it to him 5 years ago, 4 years ago nearly. Yeah. And he only got 2 million cells MSC from from solid cord and placenta, and that's all he got. And we had very good results. But it's not the same like cord blood. I want to know, why is there such a big difference?
Because it's working. It's in European Union. It's prohibited to isolate and prepare another generation of the stem cells. You know, the cultivation of mesenchymal stem cells is prohibited in European Union.
I know, but like
so it's not possible to obtain this amount of cells per kilogram. It's not possible in normal way. You must break the law, and then you can
yes, I know, but we are talking about
we are legal tissue bank, so it's impossible to do it this way. So we can use only that material which we have in our storages. So it's
okay. So if I come to you and I say I want 20 million cells a kilo, from cord blood, you will find for me a unit that's at least 20 million cells a kilo.
Exactly. Yeah.
And how much would it, like for a child weigh 20 kilo, how much something like this would cost?
It's €7,500. Yeah.
Okay, I understand. Thank you.
Yeah.
Charlotte?
Yeah, regarding the amount of cell, any maximum that the child can get using the treatment? We are only talking about the minimum right now, but if I have a unit, let's say I'm using my own cord blood or autologic or sibling cord blood, and I have a large unit which has a lot of cells, do you have a maximum number of cells that you can use in the treatment?
Yeah, in autologous way, it's we are using everything. So you have it depends. Sometimes some cord blood bank prepare the material, divide it in some vials or some bags, cryopreservation bags or something. If you have only one, we must use everything in one treatment. If you have 2 or 3, and it's there enough amount for your small child, we can use only one bag or one vial, and the second you can bring another time.
So it depends. In countries that are dividing their units, because I know in Europe now you have a special collection bag where you can divide your unit maybe 2 or 3 times. If it's a patient like this, they can bring a part of the unit every time, provided they have enough cells.
So the standard way is to prepare 2 bags, but it depends on the technology which is using in the cord blood bank. when you use some separators, it's only one bag prepared. It's divided for 20 and 5 milliliters, but the 5 milliliters is in effect only a sample for some test or something. So we must use every material in one moment.
Yes, this is the way we do it in Israel.
When you have two
Everybody, the
bags,
crowd here has one unit. They have 20% and 80%. If they're in this group, this is what they have. They don't have two bags like in Europe or in America.
Sometimes some cord blood banks reduce the volume and isolated only the stem cells. So you don't have any bags, cryopreservation bags, but only the cryovials. There is also the possibility to have 2, 3, maybe 4. It depends on the amount of blood and amount of cells, because there are some rules how many cryoprotection medium you must use for how many cells and anything. So it's individual. It's individual about discussion.
Yes,
it also depends
for Israelis,
kilograms.
It doesn't exist. Israelis only have the one bag. It's divided 20-80%. So we don't have this option. If you receive a unit from Israel, this is what you will get.
Yeah, so it's a one application, one unit for one application. Yeah.
So anyway, the unit doesn't waste. So you're using the whole unit. If that is the okay.
Because it's impossible cryopreservation. When it's thawing once, we must use it or waste it. It's impossible to cryopreserve it. Yeah.
Okay. And any manipulation or enhancement that you are doing to the unit before the infusion?
It's a whole protocol. It's many steps. We must first thawing it, then cleaning, and many centrifugation and many other steps. And we must prepare only a relatively small volume for intravenous application. So it depends on the technology of the processing of that material which you bring with you, and we must choose our protocols best for that material and the system of the processing we can choose.
So in some of the cases, you do enhance do enhancement for the unit, if this is the right.
No, you bring or before your airing, we are obtaining your material. We put in cryopreservation tank and wait for you. And in that day, when you come to our facility, then we started processing everything for you after that moment.
I want to repeat for patients who came in late, if I have a small cord blood unit, I can also purchase from you cord blood.
Yeah, if you have a small unit, we will discuss about it. Yeah, you have some amount of cells in your own autologous material. So sometimes it's okay. It depends what diagnosis, how many problems, and everything with the patient, and also the weight of the body of the patient is important. If it's okay, we can use it. If it's too small, it's not good for you to use it because it's not enough. Then we can discuss about autologous material.
I will bring my unit, and I will also receive a unit from you to make the total bigger.
It's possible, but not in the same day. When we use your small autologous material, it's good to stay 2, maybe 3 days in Slovakia or somewhere and came again, and then we can add you or give you another autologous material. It's not good to mix it in one day because so it's another technologies.
That's fine. I don't think we have parents who will have a problem to wait a few days. But let's say I will bring the child's cord blood and also his sibling cord blood, and I want to give them both. It's also the same protocol. I will give child's cord blood, wait 2 or 3 days, and then give the other unit, right?
Yeah, it depends on the healthy conditions and then other diagnosis of the patient. When it's absolutely healthy, it's only only one diagnosis is autism. It can be used in one day, some 4 or 5 hours between it. But when there are some other problems with the, I don't know, some systematic neurons problem or something, diabetes or something else, the interval between the application must be more 1 day, maybe 2 days. Yeah.
And what about CP? Like the same condition, I have a few units. I want to give
It's
them
the same.
all.
It's the same.
שאלות נוספות, חבר'ה?
I do have a question regarding the background checks you do on the unit before. Which background check do you provide or do you require for the treatment on the unit on the blood unit itself?
Yeah, maybe question for Renata. What we need before we have some list of the tests and documentation and everything what we require for. I'm not sure exactly in this moment, but it's according by our legislative and some
what he
necessary
means is like, do you do contagious diseases like HIV?
Yeah, of course.
Do you do cultures for the unit?
Virological tests, bacteriological tests, and when is a sibling donation, you must have a genetics compare and many other things. So
when I
I'm
get
not
a
sure
unit
exactly
from
now.
you, when I will get a unit from you, you will give me the information of all the virology, all this stuff. Do I get it before you do the IV, after you do the IV?
Yeah, what we need about this, pack it together, what we're missing, we need all information.
We need the information before the application, of course.
אוקיי. אתי, שומעים אותך. אני לא, הגבינות במקרר, אל תדאגי. Okay, so I want to know what kind of tests you want the children to do before they come to you. What do you want to see in their medical file? What kind of blood tests you require, etc.
Yeah, we have list of the lab tests, and we are sending to the parents this information before, and also we have patient questionnaires prepared for the parents, and also we need the medical record not older than 6 months. So everything, this is the first step, like the consultation, and need to know everything about the children, healthy condition. And also, if you want to use the autologous material, we need the certificate about your autologous materials. And we need to see how many cells, confirmation, testing, everything.
Okay,
this is
I
first
received this, can you send it to me, all this information, so
yes,
I can add it to this, to the viewing of this video?
Yeah.
Thank you.
Yeah, the lab test is for some disease, some information marker, liver function, everything. So we need to know more information about the patient.
I have, if I can ask a question. Hello?
Yeah.
I have a question regarding the cord blood unit, the donor, cord blood from donor. How do you do the matching? What is the criteria for matching? Which unit do you choose for the child?
The donor's material is testing before we start everything. So when we receive the donor's material, going to the labs, and we are doing all tests. It's like the donor's material stays 3-4 weeks in the isolation, and when we use all these results from the testing, we can put and freeze, because if we don't have results or something is not correct, we can't use it. It's under the law, so all donors' materials is very strictly controlled by testing.
No, I'm asking, maybe you didn't understand me about if you do an HLA matching or do you do like blood matching? How do you choose which donor cord blood to give? Is it unmatched, low match? How many losses out of 6? Like 4 out of 6. What is the minimal HLA matching that you allow? Can you hear me?
אני לא הבנתי את השאלה.
אני הבנתי. I think what he wants to know is when I come to receive a unit from your cord blood bank, how do you know that the unit matches my child? For example, when I do sibling donation, I do HLA matching, and sometimes it's good and sometimes it's not good. But when I come to you, you don't have my HLA before I come. So how do you know that within your cord blood bank, you have a unit for me? What kind of test do you make?
Yeah, we don't need HL testing and matching because it's not problem. It's individual. It's a general material. We can use the same cord blood for you, for me, for everything, because we are preparing only the stem cells isolated from or the all group, the mononuclear cells from the cord blood. It does not depend on the blood type or the anything else. The problem between the sibling or materials is that the technology of preparing. You have a red blood cells there, erythrocytes, and this is the problem. Therefore, you must have a matching, but it's not necessary to have.
What you are trying to say is that when we do blood transfusion or genetic material transfusion, we have the whole blood. The technology that we are preparing is different to your technology. And because the technology you are using is the kind of technology that doesn't require HLA typing, basically I can receive a unit from any person. That's what you are saying? So there's no, I don't have to do even HBO classification? Nothing?
It's not necessary. It's universal material.
זה מה שהבנתי שכולם עושים אפילו.
לא, לא כולם עושים.
לא כולם? שלא צריך מאצ'ינג אם זה לא שלך, כאילו, שמור.
אז לא, זה תלוי טכנולוגיה. Okay, this is very good to know because it's not the same protocol everywhere.
No, it depends on many aspects. But in our facility, it's to prepare the material for the donor from donors in this way. So,
but you do need to do the blood type matching now.
No, it's not necessary because in our material, in the intravenous applications everywhere, it's any red cells and anything. So it's
any blood type to any blood type. This is what you are saying, right?
Yeah.
Okay.
Yeah, there is no matching of blood for any stem cell treatment anywhere, even Mexico or any other place of the world. We have been in several places. It's a generic thing that they extract from the cord blood from the donor and then give it to the child, whoever is coming, and that depends on the child how much you take it. Like in this case, we're talking about 10 million per kilogram, right? So there is no matching criteria to anywhere in the world.
Yeah, it's not necessary. Yeah, you're right.
So what is the max number of cells that you can give or are given to any child so far for the IV and the IT?
Yeah, IV application is maximum is more than 10 millions per kilogram. It's sometimes it's 10 and a half, sometimes 12, sometimes 14. It depends. We can use only whole dosage from our storage. So that compare with your wide your child. And for intrathecal applications, it's like a local application. It's not calculated per kilograms. It's a one dosage per application. It's around per millions of stem cells in the one injection.
It's 1.5 milliliter cells in own plasma.
It's
so how many cells will be there in 1.5 millimeter like solution approximately? Is there a way we can count?
It's a count around 2 millions.
Oh, just 2 million?
Yeah.
So when you extract the cells from the cord blade, do you do like any kind of expansion on the cells work like the other units are doing, like in Mexico or in India and several places? They do some expansion and culture the cells, and they make it as like 300 million, 500 million cells. So and they inject into the body, right? Either through IV or IT. Do you do like any kind of expansion on the cells that you extract from the
expansion of stem cells or every cells in the European Union is prohibited. So we can't do it. We know how it works, but it's not possible to take in practice in European Union because it's prohibited by law.
Oh, you cannot. Why? Is it dangerous?
It's a theoretical risk there that the cells changes their
its quality.
It's not only quality, it's because of the concern of making humans from stem cells. It's not only because if it's dangerous, because other places, not in the European Union, obviously do it, and their patients are still alive. There is also a religious and political reason behind this problem.
European Union is very special, not only in this way. It's horrible and terrible here. So, but we can do it.
The reason is basically, the reason was because of what happens in the years following what happened with Dolly, the sheep Dolly, if you remember. This is the reason why it's prohibited in the European Union, because after they made Dolly, they tried to make embryos. And technically it is possible, but morally it should not.
Theoretically, yeah.
Theoretically it is possible. There were even labs who claimed that this is possible, and they've done it. But because of it, the expansions of stem cells in the European Union is prohibited. That's a reason. Also in Israel, you cannot do it in Israel because of this reason.
So if you were to expand like 10 million cells so that you are giving per kilo, how can max it can be expanded in your experience or based on your knowledge?
I'm not listening exactly because some technical problem.
You can't do it. The answer is you can't do it. He said it very specifically. You cannot do expansions in European Union. It's not allowed.
So but if you want to have the big count, you can put together more source. It's maybe about this we are asking. It's not for the expansion, but you can put 2 or 3 source with 10 and 10 million cells together, and you have the big count for the intravenous application.
So if the kid is like 20 kilos, and if you're talking about 10 million per kilo, so we are talking about 200 million, right? Right there, without expansion, like as it is, correct? So if we were to calculate like 200 million is the source that we are giving, so can you give like 100 million IT and 100 million IV application?
You could do, because if you have source with 10 millions, you have 10 dosage with 10 millions. So if the people are adult and want to have 100 million cells, you put together 10 dosage and you can inject, but need to more source.
We gave like 500 million like a couple of weeks ago in the Mexico, 300 million IT and 200 million IV application, and we have given given in
10 girls, 10 small volume with 10 millions and inject intravenously. In the Panama, they made the same. One day you receive 10, the second day 10 millions, and again, it's another source. But you have more and more, and we could do the same.
Yeah, the Panama only gives like at the max like 65 million. They won't give more than 60 million. But if it comes to like Mexico or the Costa Rica or any other place, we have visited Costa Rica and we also visited the Mexico. They give even 500 million also, including IT and IV. And we have taken already. So 200 million IV and 300 million IT. It did work out.
Mexico allows expansions. You have to understand.
Source. One cord blood, and everyone is from 10 millions and 2 millions, and put together how many sources you need. So if you want to have 100 million cells, you need to put together some source, and you have this big account.
Yeah, but you already...
It will be expensive. Can I understand from you? It's just expensive.
Yeah, just about this is the difference.
Lots and lots of IVs.
Yeah, it's different price because if you use one source with 10 millions is 5,000 euro. If you want to use 100 million cells, it's different price because you need more.
Okay, so you reached Panama prices.
Yeah.
But they are talking about 10 million cells per kilo.
Yeah.
Not the whole unit, 10 million cells.
No.
So I think 100 million cells is like
10 kilograms
10 times more than what we give in the minimum here in Israel.
Yes, I understand.
I don't think it's necessary.
Can it be even dangerous?
More cells increase the risk of some side effects, so headaches, temperature, fevers, vomiting, and everything else. The patient must have or must be absolutely healthy or more healthy in liver, kidneys, and everything, because it's a huge amount of stem cells, and then can attack that filtration organs in our body. So it's not a good idea to increase to ever and ever more and more, because there are also some maximum. It's not true that 10 times more bigger amount of stem cells is 10 times better for the patient. It's not true. It's not true. Sometimes it's better to come 5 times with a small amount of cells, and the results are much more better comparing with one big doses of stem cells. So it's always about discussion, and it's very individual. What's the problems, what's the diagnosis, and what's the waitings from the patients or the parents of patients and the child, and so. So it's not easy to say what's better for the patient. It's really individual, in fact.
So on your protocol, when you say like 10 million cells per kilogram, are you not calculating if the child weighs like 20 kilos, for example? Are you not saying like 200 million are the cells that are going to be given as a whole for the treatment?
When the patient have 20 kilograms, so we are using 200 million kilograms for him in one application or more.
200 million cells in one application, correct?
Yeah, when you are to 20 kilograms, so it's 20 times 10 millions. Yeah, so it's 200 millions kilograms.
So your price is for the 200 million, that 7,500 that you indicated if we use like IT and IV together, correct?
Yeah, because the intrathecal application is like a local application. It's not good idea to calculate the local applications per kilogram, because it's not any interact with the whole body. The intrathecal applications, it's like a right way to back parts of the brain and the spinal area and everything. So that operate and regenerate and to do something good for the patients only in these parts. It's not important how many kilograms have the patients, because it's only in spinal area and very small part of brain. So it's not important if you have 50 kilograms or 200 kilograms. Yeah? The dosage is very similar for intrathecal applications.
Yeah, it is like 1.5 milliliter. It's a fixed amount, but they can fit in like however many cells you want, up to certain amount. Like you can't fit like more than certain amount of the cells in that 1.5 milliliter the injection that you are giving, right, for the IT way.
Yeah, the standard amount it's around 2 million
2 million
stem
2
cells
milliliter.
Totally, yeah. It's not per kilogram, and it can be 1.5 million, half and 6 or 2.2. It's not important. It's around 2 million per dosage per application.
So
I think because the hour is getting very late, and we do have another meeting in next week. We are going to have to move it because it's coming out to be the day that Jewish people fast. So I think maybe we'll do it the next day. But I think that for today it's enough for now, and we will meet again next week to continue discussing adults next week.
Yeah.
Anybody has one last question that you want to ask?
Yeah, my question is like, what is the max amount of the cells that you can give for a child of 20 kg, including IT and IV way, both IT and IV? What is the max number of cells? If the child weighs like 20 kilograms, what is the max that you can give?
Yeah, it's depending of the health condition. The minimum it's 200 million stem cells, but it can be also 300 or 250. It depends. It's maximum is around 5, maybe 600 millions. Yeah, so the maximum.
So you can go up to 500. We have given 500 already a couple of times, so it did work out. We did not have any side effects.
Yeah.
So that was the main question. Yep. Thank you.
Anyone else before we say goodnight?
How months after therapy we can see improvements?
Did you hear, doctor?
No, I'm not listening.
How long after treatment do you see improvement?
Yeah, you must wait 3, maybe 4 weeks, and then start it. Then started the first changes, first improvement. Some you can see some benefits from the application, but the main effect it's 3, maybe 4 months after application take place. So it started after 1 month, and the maximum effect came after 3, maybe 4 months. Sometimes after a half of a year, it's also individual.
Do you have
so it's not instant effect. You must be patient, and you must the regeneration processes need time, and you must wait for it. Yeah.
Do you have stories of kids turned into completely verbal from non-verbal?
You have experience with verbal and non-verbal children. Do you see the difference between them?
Yeah, the non-verbal autism child, very often the first changes are started to speak. They improve the speech and starting to say sentences and anything. This is very often, and the verbal it depends of the problem. There are very often there are changes in the incoming food, improve the appetite, and they started to be more social and anything else. But it's also individual. We are everybody else, and it's not some exactly steps how it works. Sometimes it's something before another, and in some cases it's absolutely another way. So
more common changes usually are in speech or in behavior?
Yeah, the speech is very early. Very early. Improving the speech is very early reaction after the applications. when it's a inverbal patient. Yeah.
And then what's the interval of time between treatments that you guys employ?
I'm sorry, I'm not listening. I don't know why. I only
how soon
every
can you do a
5
treatment?
word I'm listening.
Uh-huh.
Okay. Hi, it's Chagai again. I think we're going to wrap it up. I just want to say a few words for the Hebrew speakers and bid you good night. אז חבר'ה, אנחנו נעשה סיכום בקבוצה, קבוצת הפייסבוק למה שהיה בשיחה, מסקנות שלנו ומה הלאה. ניפגש שוב שבוע הבא לגבי טיפול במבוגרים, ושיהיה לכם המשך לילה טוב. אוקיי, good night.
לילה טוב, תודה. Thank you.
Good night.
Thank you.
Thank you.
Thank you.